Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we are going to start with the barrier methods of contraception, right? So in the previous module, we dealt about the natural methods of contraception, right? So from this module onwards, we are going to deal about the barrier methods of contraception. So while discussing about the barrier contraception, we have so many things to discuss about barrier contraceptives, right? So I have essentially divided this barrier contraception into various segments, so it would be easy for you to go by the name of each of these segments, right? Okay. So in this particular module, we are going to deal about the condoms, right? The male and the female condoms will be discussed and described in detail in this module. Clear? So let's start with the topic. So while talking about the barrier contraception, we have divided it into two things, right? So one is the physical barrier method and the second is the chemical barrier method, right? Even physical plus chemical barrier methods can also be used. So all these things will be discussed now in later sections, right? So but to be in very more particular, barrier contraception could be a physical barrier as well as a chemical barrier. Okay, so now what is the mechanism of action by which this barrier contraceptives are acting? So the main mechanism is that all these barrier contraception are going to prevent the fertilization. So what is ideally fertilization? So fertilization is the process where the male and the female gamete is going to fuse. So once it is going to fuse, it is going to result in the formation of zygote, right? So the male gamete is the sperm and the female gamete is the ovum. So upon the fusion of male and the female gamete, there is going to be formation of the zygote, which in the later stages is going to get implanted in the endometrial cavity of the uterus. Clear? Yes. The function of this barrier contraception is to prevent this fertilization. How it is going to prevent the fertilization? It is going to act as a barrier between the male and the female gamete. So once there is a barrier between this male and the female gamete, then definitely it can never fuse. Once it is not going to fuse, there is going to be no fertilization and no implantation, and therefore the couple is going to have no conception, right? So that is the major use of this barrier contraception. So we are going to discuss about the male and the female condoms in detail in this module. Clear? Yes. So let's start with the male condom, right? So male condom, the ideally, the male condom, the latex condom, was invented by Charles Goodyear, right? He was the one who first invented about this latex condom. Why it couldn't be, why the latex, which is rubbery in nature, couldn't be just shaped into the shape of a condom, which is similar to the male gonad, right? So, in respect to that, he has designed this latex condom. But then the problem with this latex condom is that oil-based lubricants cannot be used with this latex condom. Why? Because is that latex is basically rubber, right? So if you're going to use oil-based any sort of lubricants to the latex condom, there are high chances that it is going to tear or break, right? So that is going to result in failure of contraception, right? So for that reason, latex condom was then replaced by the now latestly available condom, that is the polyurethane condoms, right? Polyurethane condoms, these are the male condoms which are very popularly used nowadays, right? Okay. So by discussing about the male condom, as you can see here, I have given the image. So in exams, you will be asked to pick up the condoms and they will be asking you to just describe about this condom. So if any examiner is going to ask you about this male condom, you have to be very strong enough to take that and you have to explain in detail to them, right? So whatever points we are going to discuss here now, it is very important for your theory as well as your practical examinations. Clear? Yes. So we're coming to the male condom. As you can see here, it consists of only one single ring. Let me just show you here. As you can see here, it consists of only one single ring, right? As you can see here, just there is a single ring and it is ideally long, right? The length is going to be very much increased when compared to the female condom. The male condom, the length is more when compared to the female condom. So ideally what I'm coming to say here is that the length of the male condom is more than the length of the female condom, and apart from that, the male condom consists of single ring. As you can see here, the male condom consists of one single ring. And the third most important point is that it is very narrow, right? So this polyurethane made male condom is actually long and it is narrow in nature. As you can see here, this is compared to the shape of the male penis, right? Similar to the male penis, this condom is designed, right? So it has a single ring and it is long and it is very narrow, and at the same time the other edge of the condom has a pointed end, right? So this point is a pointed end. As you can see here, it has a pointed end. So once one end there is a single ring, on the other end there is a pointed edge, and it is long and it is narrow, right? So with the similar features, you can just identify that this is a male condom. And to be even more particular, these condoms are available as rolled condoms and unrolled condoms, right? So as you can see here, these are the unrolled condoms, because you can just visualize the entire of this condom, right? So this is unrolled, and rolled will be something which is similar to like this. Okay, this is rolled and this is unrolled. Great. Now moving to this male condom is made up of polyurethane. It is made up of polyurethane. So polyurethane is nothing but it is a kind of synthetic plastic, right? So this polyurethane male condoms are very popularly used nowadays. And the greatest advantage when compared to the latex condom is that these polyurethane condoms can be used with oil-based lubricants and anything. So for that reason, these polyurethane male condoms are much preferred when compared to the latex condom. The most important point you need to remember when compared to the male and the female condom is the number of usage. So male condom ideally has to be used only one time. So single time use is only preferred for the male condom. Please remember, male condom can be used only for one single time. That is one single act of coitus it can be used. And the most important point is male condom is coitus dependent. What do you mean by coitus dependent? Which means that if the male partner is going to have coitus with her female partner, then he has to wear it during the act of coitus. So it is very important for him to wear it during the act of coitus. Without wearing it, if he is going to have coitus, then it is going to result in conception, right? So in order to prevent any fertilization and conception, for the effect of barrier contraception to come into play, he has to wear the condom before the act of coitus. So this male partner is dependent on the condom for his act of coitus. So therefore, male condom is coitus dependent. So for the act of coitus is actually dependent on the male condom. Clear? Yes. So it is very important for you. And the most important point is that the male condom is included in the National Family Planning Program. So National Family Planning Program, the male condom is included in the name of Nirod. In the name of Nirod. So Nirod is essentially a Sanskrit word which means prevention. Right? Nirod is a Sanskrit word which means prevention. So ideally you are preventing any further conception. So it comes under the National Family Planning Program as Nirod. Clear? Yes. Now coming to the uses of this male condom. So male condom is essentially a barrier contraceptive, and since it is a barrier contraceptive, it is going to prevent you from any sort of sexually transmitted diseases. So if the male partner is going to wear this condom, then the female partner has decreased chances of sexually transmitted diseases including HIV and then chlamydial infection, gonorrhea infection. So all sort of sexually transmitted diseases will be decreased. So the female partner will be protected from any sort of sexually transmitted diseases. And we all know that the most common cause of pelvic inflammatory disease is sexually transmitted infection, right? So once the partner is protected from the sexually transmitted disease itself, then therefore pelvic inflammatory disease also the patient is actually protected. Is that clear for you? See, I told you that by wearing this male condom, there is decreased chances for transmission of sexually transmitted diseases to the female partner. If the chances for transmission of sexually transmitted diseases itself is decreased, then therefore the sexually transmitted diseases is the most common cause of pelvic inflammatory disease. Once there is no sexually transmitted disease, then therefore there is no pelvic inflammatory disease. So apparently the female partner is protected from the pelvic inflammatory disease as well. And the most important point here is that this male condom protects against the HPV infection, which is human papilloma viral infection. The most important point here is that human papilloma virus is the cause for cervical cancer. How? Because the high risk subtypes, that is the HPV 16 and 18, leads to cervical cancer, right? So this male condom is ideally going to act as a barrier contraceptive and prevents the female from cervical cancer. Why? Because it is going to protect from HPV infection. How? If the male partner is going to wear this condom, then he is going to not transmit any sort of infection into the female's genital tract. So if there is no transmission of HPV virus into the female's genital tract, then therefore there is no risk of cervical cancer in her. So ideally, the female partner is protected from sexually transmitted diseases including HIV, chlamydia, gonorrhea, and she is also protected from pelvic inflammatory disease and HPV infection, which later on leads to cervical cancer, right? Okay, and not the least very important point is that the male condom protects from pregnancy, including the ectopic pregnancy chances are decreased. But then the most important point is the failure rate of contraception. See, whenever we speak about any contraception, we also need to learn about the failure rate, right? The failure rate is around 2 to 12 failure rates per 100 women years, which means, let's say for example, you are prescribing this male condoms to 100 male partners, right? So 100 of the males are going to use this male condom. Out of these 100, at least 2 to 12 number of males had act of coitus and that result in conception. So out of this 100 women, 12 got pregnant. So the failure rate of male condom, which is weared by the male partner, is 2 to 12 per 100 women years. Clear? Yes. And then we have few more advantages with respect to male condom, and that is it is very cost effective. That is, it is not much expensive. It is very inexpensive and you can get it from any pharmacy without a prescription of a doctor. So it is very cost effective as well. And at the same time, this male condom can also be used with the other methods of contraception. So any sort of backup methods or add-up methods can be followed along with this male condom. The disadvantages, which is the second most important point with respect to male condom, is this can tear or slip off. So if the male partner is going to wear this male condom, there are increased chances that it can either slip off or it can either tear during the act of coitus. So if it is going to tear, it is going to result in deposit of the male gamete, that is the sperm, inside the female's genital tract. So if it is going to be deposited inside the female's genital tract, it is going to result in increased chances for pregnancy, including the ectopic pregnancy, and there are increased chances for transmission of sexually transmitted diseases as well. Is that clear? Yes. And the second most important point is that I told you in the starting itself that latex condom was the first condom which was developed for males, right? But due to the disadvantage that oil-based lubricants cannot be used with the latex condom, it was later replaced by polyurethane condoms. But in case if you're going to use latex condom, certain people are just allergic to latex. So because of this allergy to latex, they might have some symptoms like swelling of the penile, burning sensation, itching, anything could be present. So allergy to this latex can also be a disadvantage with respect to the latex male condom. And apart from that, if you're going to use any sort of spermicidal agent, what are spermicidal agents? So spermicidal agents are those agents which are chemical barrier contraceptives. So you're going to use this spermicide, which is either in the form of a gel or a suppository, right? So this gel is going to be mixed along with this male condom as a lubricant. Right? So this spermicidal agent is going to result in decrease the motility and the vitality or the viability of the sperms. So the male partner is going to have coitus with the female partner. Along with the male condom, he has used this spermicidal agent. So this spermicidal agent used along with the male condom, the major action of this spermicidal agent is to decrease the motility as well as the viability of the sperms, right? So once the viability and the motility of the sperm is going to be lost, then therefore the partner is actually protected from any conception. But the disadvantage with respect to this spermicidal lubricated condom is this spermicidal agents can sometimes promote the growth of bacteria. So if it is going to promote the bacterial growth, sooner or later this bacteria can actually ascend up the urinary tract and can lead to increased risk of urinary tract infection, right? So spermicidal agents can promote the bacterial growth and increases the risk of the urinary tract infection. And not very important point is it is single time usage, right? So male condom is ideally coitus dependent and it can be used only for a single act of coitus. So single time usage is one of the best disadvantage with respect to the male condom, right? So every time to have coitus, the partners have to get it from the pharmacy, so every time he has to pay for it. So with respect to that, it is a disadvantage to the male condom, right? So single time use it very particular to male condom. Clear? So all these points which I have discussed until now is all about the male condom. Is that clear? Let's move on to the female condom. Okay. So with respect to female condom, the most important point which is very frequently asked in your community medicine is the female condom is invented by Lassie Hessel in 1984. It was invented by Hessel in 1984. Now coming to the image. As you can see, the female condom is ideally 17 centimeter long, right? The length is about 17 centimeter. Please remember, the length of the female condom is about 17 centimeter. And in contrary to the male condom, the female condom is going to have two rings. It is going to have two rings, which is ring number 1 and ring number 2. But then the most important point here is that even single ring female condoms are also available now in the market, right? So single ring condoms are also available. At the same time, double ring condoms, female condoms are also available. But the most important differentiating feature is that, see, the ring number 1 is actually large, right? But the ring number 2 is actually small. So one end is going to be a large ring and the other end is going to be a small ring, and at the same time the small ring is going to be a closed portion. See, this portion which is large is open, but this portion which is small, it is closed. So this is one end and that is the other end. The length of this female condom, which is similar to a pouch, is about 17 centimeter, and in contrary to the male condom, which is narrow in nature, female condom is broad. So this pouch, it looks typical to a pouch, right? It looks like a pouch. So it is 17 centimeter in length and it is broad in nature. It has two rings. One end is going to be a large ring and it is open, and the other end is going to be a closed ring and it is small. In contrary to the male condom, there is no pointed end in female condom. Clear? Yes. So it is a single ring condoms are also available now, and at the same time the double ring condom, female condoms, looks like a pouch. Clear? Yes. And this female condom is going to lie entirely inside the female's genital tract. So it is going to include the external genitalia. Entirely it is going to lie in the vagina up to the apex of the vagina. So it includes the apex of the vagina, entire vagina, and the external genitalia, as you can see here, right? So this is one end. Let me take a different color so that it will be much easier for you. So this is one end which is long and it is going to lie in the outer external genitalia, and the other end, as you can see here, it is small and it is covering the apex of the vagina as well as it surrounds the distal portion of the cervix. So this female condom is going to cover the cervix, the apex of the vagina, entire vagina, and the external genitalia. Right? Clear? So now coming to how this female condom is made of. So female condom is made entirely of polyurethane. So female condom can actually be made by two things, right? So it is actually female condom 1 and female condom 2. So female condom 1 is all about the polyurethane condoms, which is a synthetic plastic condoms, whereas the female condom 2 are nitrile condoms. So nitrile condoms are female condom 2, and these nitrile condoms are much popularly just prescribed, right? Popularly used among the population is these nitrile female condoms when compared to the polyurethane condoms. Whereas in male, polyurethane male condoms are more popularly used. In females, nitrile condoms are more popularly used than the polyurethane female condoms because it is very cost effective when compared to the polyurethane condoms. And the most important point to remember here is that the female condom is actually coitus independent. What do you mean by coitus independent? I told you that male condom is actually coitus dependent. That is, the male partner has to wear this male condom before having any act of coitus. But on the contrary, the female condom is coitus independent, which means that the female can wear this female condom at least she can wear it any time during the day, right? It is not very necessary that she has to wear this condom only during the act of coitus. It is not like that. She can also wear it half an hour before the act of coitus, and she can remove after the act of coitus. It is very clear. See, male condom is coitus dependent. That is, the male has to wear the condom before having any act of coitus. But the female can wear this condom at any time. Let's say, for example, even half an hour or 1 hour before the coitus itself, the female can wear this condom. So she is not dependent on this condom. So female condom is coitus independent. That is, she can wear at any time before having the act of coitus, and once the act of coitus is completed, she can wear and she can just remove and throw it, right? Clear. So male is coitus dependent, female is coitus independent. Now coming to the maximum reuse time. So maximal reuse is one time. So one time it can be reused, which means that totally 2 times you can use this female condoms. On the contrary, male condoms can be used only one single time. But female condoms can be used for at least 2 times. If you are going to use it for more than 2 times, then therefore the efficacy of this female condom is going to be decreased. That is, the efficacy of the female condom in preventing the conception is going to be decreased. So more than 2 times if you are going to use the female condom, then therefore the efficacy of the female condom is going to be decreased. So therefore the total number of times a female condom can be used is just 2 times. But the reuse time is just one time. Clear? Okay. And exactly opposite to the male condom, this female condom is not included in the National Family Planning Program, but it is included under National AIDS Control Program, that is NACO, right? National AIDS Control Organization. Under the program of National AIDS Control Program, these female condoms are included, wherein it is given for female sex workers. So for all female sex workers, in order to prevent the AIDS, they are just giving this female condoms to all the female sex workers in prevention of AIDS. So female condom is included in the National AIDS Control Program, and the male condoms are included in the National Family Planning Program. Clear? Yes. Now, what are the contraindications to female condoms? So the females who are allergic to the polyurethane or nitrate, right, nitrile or polyurethane, those females cannot use these condoms if they are allergic to this synthetic plastic, which is polyurethane and nitrile based female condoms. And at the same time, any female with vaginal wall prolapse, that is cystocele, that is urinary bladder prolapse, and the rectocele, which is the prolapse of the rectum, the posterior vaginal wall prolapse. So any sort of vaginal prolapse, the female condom cannot be fitted properly in place. So these are the absolute contraindications, right? Cystocele and rectocele. And also the patients who are just allergic to polyurethane and nitrile, they can also not use these female condoms. Now coming back to the advantages and disadvantages. Advantage is that it protects against pregnancy, right? If the female is going to wear this condom, then she can protect herself from any conception. So protection against pregnancy is one advantage. The second advantage is that protection against sexually transmitted infections, including HIV, chlamydia, gonorrhea, and etc. And at the same time, it is very safe, simple, and convenient to wear this female condom, right? And it is coitus independent, as we have discussed earlier. And the most important advantage is that the female condom can be used with lubricants also. And the most important point is that the female condom can be used in the postpartum period or during the puerperal period, and also it can be used after abortion. So after delivery or after abortion, these condoms can also be used, right? Fine. Now coming to the disadvantage. The disadvantage is the increased failure rate. The higher failure rate is the most important disadvantage with respect to female condom, wherein if you're going to give this female condom to 100 women, out of the 100 women, at least 5 to 15 or 5 to 20 females are going to result in pregnancy. So the failure rate is higher when compared to the males, right? So when compared to the male condom, which is somewhere around 2 to 12, right, the female condom is 5 to 20 per 100 women years. So higher failure rates are with female condoms more than the male condoms. Clear? And the second most important disadvantage is that female condoms are expensive, unlike the male condoms. Male condoms are not much expensive, but the female condoms are very expensive and not readily available. Clear? Yes. So in your examination, if anyone is going to take a condom and giving to you and ask you to describe about the condom, these are the most important salient features which are expected from you. Now I have just a more important question for you. Let's discuss about this question now. So the question is, which among the following methods of contraception can be used in the puerperal period? Right? So the puerperal period is after the delivery of the fetus, right? Yes. So during the puerperal period, which among the following methods of contraception can be used? So puerperal period is sometime after the postpartum period, right? So after the delivery of the fetus, the female is going to be in the immediate postpartum period. So puerperal period is around 6 weeks after the delivery of the fetus. So until 6 weeks, what are the methods of contraception which can be used during the puerperal period? So the options are female condom, diaphragm, and natural methods of contraception, and none of the above. So let me tell you that female condom is a barrier method of contraception, right? And diaphragm is also a barrier method of contraception. And this is natural method of contraception, and the fourth option is none of the above. The answer to this question is female condom. So as we have discussed earlier, female condoms can also be used during the postpartum period, that is the puerperal period, and also after abortion. Immediately after the abortion, this female condom can be used, whereas the diaphragm cannot be used and the natural methods of contraception cannot be used. Why? Because is that diaphragm is similar to the cervical cup. We all know that the cervix is going to be dilated about 10 centimeters in order to facilitate the delivery of the fetus. So the cervical dilatation will revert back to its normal position not immediately after the delivery. So it will take some period of time for the cervix to just come back to its normal length. So from 10 centimeters, it has to decrease to its normal length. So during the immediate postpartum period or in the puerperal period, you cannot place any diaphragm. So diaphragm is a device which is basically a barrier contraception which is placed in the cervix. So since it is placed in the cervical length has to be normal. But in the puerperal period, the cervix has to revert back to its normal length. So unless and until it has reverted back to its normal length, you cannot just insert this diaphragm during the puerperal period. So this barrier method of contraception diaphragm cannot be inserted during the puerperal period. So that option is ruled out. The second option is natural method of contraception. Why natural method of contraception is because natural method of contraception can only be used in a female who is having regular cycles. At least she should have a 28-day regular cycle or 30-day regular cycle or 32-day regular cycle. But immediately after the delivery of the fetus, right, the female cannot have any natural method of contraception because she is not aware about when her cycle is going to start and when she is going to resume menstruating and when the cycle is going to stop. She has no knowledge about it, right? So immediately after the delivery of the fetus, she is going to be in a period of lactational amenorrhea, right? Lactational amenorrhea is when she is going to breastfeed. Because of increased prolactin, it is going to have a negative feedback, and because of this negative feedback, there is decreased amount of estrogen and progesterone, right? So there is going to be no menstruation. So for about 6 months after the delivery of the fetus, the female is going to be in lactational amenorrhea. So if she is going to have coitus after this period, she cannot be very ascertain about when her cycle is going to start, what is the frequency of the cycle, and how many days she is experiencing. All these can vary. So therefore, immediately after the delivery of the fetus in the puerperal period, the natural methods of contraception cannot be relied upon. So therefore, the best option here is the barrier contraception, that is the female condom. Female condom can be used in the immediate postpartum period, immediately after the abortion as well. Is that clear? So all these things which we have discussed until now is all about the male and the female barrier contraception, that is the condom. So let's meet in another interesting module with the other important barrier contraceptives. And let's just start studying whatever you have just studied until now in Mackler. You start revising everything and you will come up with another interesting module. If you haven't subscribed to Mackler, please subscribe to Mackler YouTube handle